So welcome back. I'm with Dr. Wojak from Mountain Medicine in Northern Arizona. So thanks again for being here today.
Of course.
We had a great first segment. We're going to dive right into segment 2 because this is actually where it's going to get interesting. We're going to talk a little bit about, kind of what to expect and treatment conditions and things. So one of the first questions that comes to my mind is, what types of physical ailments or conditions is it happening to a patient, or they're not getting treatment from a regular doctor that they all of a sudden think, well, let me try a naturopath?
Right. So here you could talk about a million different medical conditions and signs and symptoms and different things like that. A few things that are huge and very prevalent that come to mind there's always going to be like pain. So many people have low back pain. A lot of people have like arthritis pain, different things like that.
Mm-hmm.
And so coming up with a more holistic manner or naturopathic manner of trying to treat that. So you could do it with diet. You could do it with different supplements and different things like that. And another big thing is like take gastrointestinal issues, for example. Gas, bloating, heartburn, diarrhea, constipation.
So these are, it's funny, I'm going to interject because this is where I feel that we need to be real every day. So the first thing that comes to mind is, how many people out there do you know think, oh, I just have heartburn.
Right.
So I'm going to get some Pepto-Bismol, or I have diarrhea because I ate something. And, they don't realize that it could be a bigger issue.
Totally. Absolutely.
And that's what came to mind as soon as you said what you did.
Right. And they don't realize it's a bigger issue, or they just think that taking antacids or taking something to treat it every time is going to deal with it, and there's nothing underlying as a thing. So we can work with that and hopefully resolve it.
So the bigger message here is that when somebody is going through some type of physical pain or illness or a chronic happening, like it's chronically happening. I have chronic indigestion. I have chronic upset stomach. These are not normal things.
Right.
This is not things that people need to say, this is just me, and it just happens to be how I am. There's a reason, and you need to have it looked at. And it's not about a pill. It's not about getting a prescription. It's about finding out what's going on in your body to...
That's a great point. So many people have been living with things for so long and that they normalize it and they take certain, drugs or different things and think that that's it. Like that's how my body works and I can't do anything about it.
Well, so for those of you who have followed or are following the Mouth for a year, this is why I exist. This is my message, because people, if you're going to live a long and healthy life, you have to look at things for what they are, not what you think they're going to be or what you think they are, what a doctor tells you or a prescription tells you. And you have the power to change these things as long as you ask the right questions and ask questions. Don't just say, this is how I am, or this is, the doctor said this is what I'm, I have a family history of this or that. Really dive in and invest in yourself and your health, because if your car was making a noise or, your flower in the garden was, unhealthy, you would do the things you needed to do to fix the car or make the vibrant flowers healthy or make the flowers more vibrant. So you do the same thing for your own body.
Exactly, and that's the thing with naturopathic medicine is people don't know we're out here.
Right.
So that's the main message is they don't know if there's other options or the next place to turn or there's misinformation. So getting them in a good direction, and sometimes it takes a little bit, but once you start getting the ball rolling, then you can find a really good improvement.
So at what stage in a patient's healthcare journey do they typically end up with a naturopath?
Yeah,
what do you typically see?
Right, and that kind of goes back to one of the first questions we had. What kind of demographic or people that we see is, a lot of times it's those people that are frustrated with going to the regular doctor and just getting prescribed something and they don't want to take it anymore, or they've tried multiple different things and it hasn't worked, or they've tried this and they've tried that and they're just frustrated. They come and see us and we get a look at it in a bigger, broader area and see what's going on, and we get to know them. So that's another thing that really sets us aside is we take time with patients. We take the time to get to know them, and it allows us to discover those things that might be hindering their health.
So it's not a quick fix. It's actually discovering what's wrong so you can actually improve for a longer duration of time, not just a quick, here's a a pill and it's
Exactly.
going to hide that
Yeah.
or make it go away.
Yeah, and not to say that there's definitely multiple times where some things can be easy or
Okay.
or have a quick solution.
Right.
But yeah, you know, if you're looking to improve your overall health, especially if it's been a chronic thing.
Well, give
it
me an
could take some
example.
time.
Let's dive into just, even for a couple minutes, dive into a specific type of condition / treatment that maybe you see more common that,
Sure.
you know, readers and followers can relate to.
Oh yeah, absolutely. I mean, I'd say a couple of the biggest ones, going back to pain is really big. Weight loss is huge as well.
Okay. So
and
you're
then-
saying people that are trying to lose weight.
Right.
Okay.
Yeah. I mean, that's one of. I mean, there's probably thousands upon thousands of commercials and things about that, and supplements and stuff out there trying to figure out what to do, and making it more of a sustainable change is what we're going for. Things that are going to improve stuff that you improve on, and then there's no backslide.
So let's take weight loss.
Mhm.
So I'm a patient and I come in and I say, you know, I'm 50, 60, 100 pounds overweight. I've tried every different diet. You know, I've lost some, I've gained it back. You hear all these stories. What do you do first? Like, what happens?
Right. So, I mean, the biggest thing is just try to see what they've done before, how long they've done it for, how committed they've been.
Okay.
A lot of times, that's kind of the main part right there. Is people will try these fad diets and they'll go on them, and a lot of them are very restrictive.
Okay.
And so it's, you know,
It's not natural.
it's not natural. So it's like, you know, and we only have so much willpower. So it's like, how long can you be on these diets where you're restricting calories and you're doing things where your body doesn't feel fully nourished just to lose some weight?
Right.
So it's more about trying to find something that works individually for that person,
Right.
and then making it a more consistent lifestyle change rather than labeling it as a diet, essentially.
So you have an exploratory kind of conversation with them, and are you doing tests after that? Like, kind of explain.
Sure, and
how that looks.
it all really depends on, you know, how they present, what they've done in the past, and things like that. So of course you want to look at metabolic function and hormones and things like that. Things that are gonna affect the weight of the person in general. So if you have like a hypothyroid condition and you're not aware of it, then that's one area where you might be putting on weight and just have no idea why, no matter what. Like,
No matter what you do,
what
you
you're
can't get rid of
changing.
it.
Right. Exactly.
And then, so do you prescribe medicine as a naturopath? Or explain what
Sure.
medicine is, and I guess in your industry.
Right. Yeah. It all
Because it
depends
could be
on what you
different.
define as medicine. For us, it's going to be more natural. So you're talking about like botanical medicines, nutrient supplements, things like that, like natural.
So the
sources.
pharmacy training, do you ever use that?
Yes, definitely.
Okay, so you can prescribe a normal
Mhm.
physician prescription that I would get from my primary care physician or something.
Exactly.
Like that.
In the state of Arizona, we're able to do that,
Okay.
and we could even get DEA license and are able to do like opioids and things like that if we would like to as well. The biggest reason to get that, a DEA license would be if I want to take somebody off of a medication,
Okay.
I have to be able to prescribe it myself, and so that's the benefit of being able to prescribe those as well. As a lot of times I'm taking people off of medications.
Okay. Well, that's a positive, I think.
Yeah, but let's say you come in and you're really sick, and you need some antibiotics, and we need to hit something hard, and that's kind of the main way to go. I could still go that route and then support your immune system.
So, do you have patients that come to see you because they have a cold?
Yeah. Oh, definitely.
Okay.
Absolutely.
That's
Absolutely.
interesting. I would not have expected. See, I
Right,
think of a naturopath as more like the gastrointestinal or the
Right.
gut health.
Absolutely.
But so if I have a cold, you normally would get an antibiotic,
Mhm.
I would come to your
Right.
office and I would say I can't breathe and
Yeah.
I might have an earache, and
Exactly.
what would you do?
Yeah. So in that case, you help boost the immunity. So
Okay.
essentially, the common cold tends, no matter what, like if you get it, it's going to last for about 7 days,
Okay.
no matter what you do for the most part. But we can get you feeling better and moving quicker
Interesting.
with some immune boosting elements and things like that.
Well, one of the things, and we could dive into this really far,
Yeah.
because the whole gut health thing just came to mind. But they say that antibiotics plays a huge role in that gut health and the
Totally.
mind, the brain, gut connection.
Right.
So you don't often prescribe antibiotics, I would guess.
We try to avoid it as much as possible,
Okay.
and this is one of the most evolving things in research right now is the microbiome, gut health, the interactions with antibiotics, probiotics, different blends, which ones are better for the mind. And you're right, we can go into huge in depth. Bottom line is we try to avoid antibiotics because we do know they have a negative effect on your gut flora in general. So
I heard it takes like a year.
It
So
could,
they get a
yeah.
lot of the system.
And it really depends. Yeah, it really depends on the individual and how healthy your gut was in the first place.
Okay.
And that kind of goes into prevention. So
Right.
that's what I tend to try to do with my patients is, as cold and flu season is starting, is like, hey, let's prevent this from happening. So you don't need to see me, more than you have to. So.
Okay. All right. So if I'm, say, let's not take the common cold, but say I have weight loss goals, and I know that I'm kind of starting a new regimen or a new education. How often are you seeing a patient, and how long does a typical visit last?
Right. So my initial visits are about 90 minutes long. In those, before that, I like to talk to the patient and get a new set of lab work and get as much information as possible. So I have a really in-depth intake form as well. So I have a lot of information going into it. So then I can, when you come in, we can have a really good conversation about your goals, get more in depth about what you've tried, what your lifestyle is like, exactly how you're feeling, and then go from there.
Okay.
And then follow-up visits are usually about anywhere from an hour to half an hour to an hour.
How often? Once a week? Every couple weeks?
How often kind of depends on the person. So if we're working on multiple different things, I want to see you like every 2 weeks to every month.
Okay.
And the more things we're working on and the more help that patient might need, the more often I want to see them.
Awesome.
So.
And then what should an individual expect? I think you mentioned 90 minutes in intake form. Other than that, what should an individual expect in their first visit?
Spending more time with your doctor, being able to talk with us.
So not the clock's not ticking as soon as they're
you're not going to see exactly. You're gonna walk in, and at my place I offer water and hot tea, and you get comfortable. And yes, we have stuff we need to cover, and I have different appointments, but we set that time aside so I can spend time with you and be able to cover everything we need and have the time to do it.
How many patients do you say you would see average daily?
Right, so if it was full of new patients, I could probably only see 4 or 5, but intermixed, right around like 7 or 8.
Okay, so that's a full day.
It's a full day, and it's definitely not as much as an MD, but a lot of times their visits are 15 minutes, so of course you can
just run them through.
Go right through them. So.
Awesome. Is there anything else that you'd like to share about this particular aspect of naturopathic medicine? And what I mean is, just the patient considering using it, why, different treatments, just what to expect. Because the next segment is going to really talk about, which I'm excited about, it's going to talk about insurance and all the stuff we hate, but I think it's valuable to know. So before we move into the not so fun stuff, is there anything else you want to share? Yeah,
I think one of the key things that people come in, they're very used to that conventional model of not having enough time. And if you do talk, if the conversation does get away, we can run out of time, because obviously we definitely can, but just being as forward and honest with your doc, because we want to help, and a lot of times it revolves around talking about your bowel movements and different things like that. Just getting down to the nitty gritty and being like, hey doc, this is what's happening. Let me know, so that way we can better help. So and bring as much information as possible with you. Okay. Well, that's a great way to end this second segment. We'll be back in a couple minutes for segment 3.